Okay, we'll take questions from the press now, please.
Thank you, Governor. If you'd like to ask a question, please use the raise hand function at the bottom of your window. We'll take a moment to compile the Q&A roster.
Plexiglass.
Governor, you now have John Campbell from Gannett. John, your line is now open.
Hi, Governor. Two questions for you. One, in terms of community sites for vaccination, at what point do you plan on rolling out a list or some sort of function where people will be able to find out where they can get vaccinated? And then my second question is on contact tracing data. Is there a reason why the state hasn't released any sort of statewide data that shows the source of outbreaks so we can get a better sense of whether they're happening at gyms or restaurants or whether it is living room spread? Can the state release that sort of data? Why hasn't it happened so far?
Yeah, two good questions as usual, John. The first, you saw the prioritization of the vaccination schedule. This is all subject to the federal government actually delivering that number on that day, right? And we outlined the first few stages. The general public go basically after the healthcare workers. We're looking probably at the beginning of February on this schedule before you get there. Maybe late January, but we have to see how it goes. And before we get to that, obviously, general public distribution, then we will have designed and we'll lay out actual sites where people can go to get vaccinated. But we have a ways to go before we get there. On the contact tracing data, we collect contact tracing data from local governments. Local governments employ the bulk of the contact tracers in the state. We then put it together and we analyze it. We're doing that right now, as a matter of fact, in coming up with the next configuration of our plan. We release it Friday, and I'll see if we can't put together a compilation of the local contact tracers and put it out on Friday.
Thank you.
Thank you, John. Next question, operator.
Governor, you now have Karen DeWitt from New York Public Radio. Karen, your line is now open.
Hello, Karen. Long time no see.
Karen, your line is now open. Please unmute yourself.
Long time no hear.
Okay, now I'm here, right?
Yep.
I have to work through a soundboard. I only work in audio, so this should be easy for me, but it's not. So nice to talk to you. The question I have, I talked to the New York State School Boards Association this morning. They're worried because of the 20% in state aid that has been continued to be withheld. They're also looking for reimbursement because they used their school buses this spring when schools were shut down to send meals to hungry kids. When can they expect to see that money, or are they ever going to see that money?
The school aid number, Karen, is like every other number in our budget right now. We have about a 20% shortfall. What's going to happen to that 20% shortfall? It's going to depend on what Washington does, and that's what today is all about. We're asking Washington for that 20%. That's what we are asking Washington for. If they give it to us, then we're made whole, right? We're just made whole, and they would receive the full funding. If Washington gives us some of it, then we're going to have to redo a budget. We're going to have to raise taxes. I believe we're going to have to raise taxes at the end of the day in any event. But the question is, how much in taxes, right? Because then you have to do it as part of a budget and balance the budget. If Washington gives us nothing, that hole is so big that if we raise taxes, if we borrow, if we lay off people, you still will not be able to close a 20% hole. That's how big it is. On the school buses, I don't have an update. Let me ask Rob Mahika. First, what I said on the budget numbers, do you have anything to add to that? And do you know anything about the school bus? Is that us or is that SED? Do you
Yes,
know?
it's both. We're talking to SED. So on the budget numbers themselves, we still have $8 to $9 billion in school aid payments that go out at the end of the year. That is what we would withhold, up to 20% overall in the absence of federal funding. But to date, we have not been withholding 20% from the school districts out of each payment. So we've been waiting till the end. If there's no federal funding, then we withhold that 20%. But as of today, we have not been withholding 20% from the school districts on these payments so far, but we will in the absence of the payments. As far as school districts that have used the school buses for delivery of meals, we are working with SED right now, and we have a survey out to the districts. And if in fact the school buses were used for meal delivery, then we would allow for those services to be reimbursed.
Karen, that's a good point, though. They haven't yet had, the school boards, school districts haven't yet had any reduction in funding. It would be this last payment which represents the 20%. Next question, please, operator.
Governor, your next question comes from Morgan Mackay from Spectrum News. Morgan, your line is now open.
Hi, Morgan.
Hello, Governor. How are you?
Good, how are you?
Hello.
Yes, how are you, Morgan? Good to be with you.
I'm good. Thank you. So many lawmakers and fiscal policy groups say federal aid will not be enough and there should be other cost-saving measures implemented, such as raising taxes, different things like that. What are your kind of thoughts and feelings on some of those ideas?
I don't want to give up on Washington yet, because if you give up on Washington and you assume there's no aid from Washington, balancing this budget is going to be detrimental to the state, the city, and every family in this state. And there's no reason why New Yorkers should bear more pain. We bore more pain than any state in the nation. And as you heard from the mayor and Mario Salento, this state paid the price for COVID in a way no other state paid the price. So I'm not willing to say Washington shouldn't do what is fair and right and just help us with this financial crisis, especially since it's in the nation's best interest to get the economy going, and especially since it's every state. And if you starve every state, you're going to hurt the nation. But if you said there was no federal aid and we have to do the budget, you're going to have to do tremendous tax increases. You're going to have to do massive layoffs. You're going to have to do massive borrowing. You're going to have to do all of the above. Schools will get less funding. There will be fewer essential workers. Taxes will go up, and it will hurt families, and it will hurt the economy. And I'm not willing to go there. Tax increases, I do believe, given the current circumstances, I'm skeptical that Washington ever provides all the funding that they should provide. I think the distribution becomes more political than need-based. That's what they've done thus far. And if Washington doesn't provide enough funding, I believe tax increases are going to happen. The question, though, on tax increase is how much. A tax increase is not a political statement. It's a policy statement, and it's a revenue device. I want to raise taxes. Yeah, how much do you want to raise taxes? How much do you need to raise taxes? How much do you need to close the budget? That then depends on the decisions in the rest of the budget. So people politically support a tax increase, fine, but it's not really a political issue. It's a policy issue and a revenue issue. How much on who and how much do you need? And that's why it has to be done within the budget. I believe there's going to be a tax increase, and I believe a lot of tough decisions will need to be made. I believe there are going to be a lot of cuts. But that all has to happen in a context of all the decisions in a budget. You can't do taxes without doing cuts, without doing borrowing, without doing layoffs. It all has to be in the same budget, and it has to balance. And I'm not willing to give up on getting the funding from Washington because, as I said before, it will be devastating. There is no tax increase that can make up for the lost revenue from Washington. Let's take one more, operator.
Your last question comes from Marcia Kramer from WCBS TV. Marcia, your line is now open. Marcia, your line is now open.
Can you hear me now, Governor?
I can hear you. TV commercial for a phone company. Can you hear me now?
It's hard. I had to figure out how to unmute. What can I tell you? So I have two questions. The first one has to do with the fact that you've said that you'll probably have to put new limitations on indoor dining as early as Monday. A number of restaurateurs are questioning whether there's a nexus between the spread of COVID and indoor dining, if you have any information on that, and also if there's a nexus between indoor dining and hospitals. And the reason I'm asking the question is because New Jersey Governor Phil Murphy has said he's not going to look at hospitalizations as a way to decide whether he's going to eliminate indoor dining in his state. And my second question has to do with the man in Staten Island, the bar owner, who, believe it or not, was released on his own recognizance after using his car to attack a sheriff. I wondered if you could comment on that as well.
Yeah. Let's do, thank you for both, Marcia. First question, New Jersey, some states count cases. We also count number of cases. Number of cases winds up being number of people hospitalized, right? It's just an earlier determination. But a percentage of the people who are cases will wind up being hospitalized. So if you use cases, your X percent of the number of cases are going to be hospitalized. So you wind up using the same numbers anyway. We do have data on where the spread is coming from. And we do have data on the amount of spread coming from indoor dining. They are right that it's not as bad as it was, but it's not as bad as it was because we put significant restrictions on indoor dining. And when you reduce the capacity and you have masks and you have plexiglass partitions, et cetera, yes, we have reduced the numbers. But they are still a source of spread. If you remember Dr. Fauci on Monday said, close, the original guidance was close the bars and open the schools, right? It's the places of gatherings, and it was the bars, restaurants, mass gatherings, et cetera. Do we have any numbers here, Rob? Do you know off the top of your head what the numbers are?
Yeah,
with the
the
bars?
interviews keep going, and the bars and restaurants are the 5th or 6th category of the highest contact tracing when you have a known source of where the infection was. So it's about the 5th or 6th number. Also, it's the largest growing clusters and of known infections is traced back to bars and restaurants, which actually starts to make sense as it gets colder and you're moving into indoor dining. Those numbers are growing faster than every other category.
Also, Marcia, the CDC came out with additional guidance on Friday. As I mentioned the other day, they specifically say, and I'll read it to you, I don't know if you can see it, avoiding non-essential indoor spaces and crowded outdoor settings. Exposures at non-essential indoor settings and crowded outdoor settings pose a preventable risk. Indoor venues where distancing is not maintained, consistent of masks is not possible, e.g. restaurant dining, have been identified as particularly high-risk scenarios. So this is the CDC just last Friday saying again, restaurant dining. What they point to is you can't eat and drink with a mask. Or if you can, nobody's explained to me how you do that yet. So you take down the mask to eat and drink, and that's why you're in a restaurant to begin with. And that's the spread. Staten Island, Marcia, is such a disturbing situation to me on so many levels. And I would ask people on Staten Island to think back over these past few weeks and what has been accomplished. I understand the political frenzy and the election. The CDC guidance that came out on Friday, that is the President Trump CDC. That CDC director reports to the president. That's the Trump's team guidance, indoor dining, bars, restaurants. The Biden advisors say the same thing. So all this political rancor, Trump and Biden agree on the advice. Well, some elected officials in Staten Island said, well, we're not going to follow it. Freedom, freedom. Let me tell you what their advice has done for Staten Island, okay? Staten Island went from the lowest death rate in New York City. It now has the highest death rate. Staten Island has a 40% higher death rate than the Bronx, than Brooklyn, Queens, or Manhattan. A higher death rate on Staten Island. 25% of all the fatalities in New York City come from Staten Island. Staten Island is only 5% of the New York City population, and it's 25% of the death rate. 5 times their population, 25%. That's what's happened on Staten Island. More people have died on Staten Island. More people are dying on Staten Island. That's what this movement on Staten Island has done. More people have died. And that's the fundamental point that is inescapable. That when you follow the guidance, you're more likely not to get sick, you're more likely not to be a case number, you're more likely not to go to a hospital, you're more likely to die. How do you explain Staten Island having 5 times the number of deaths? 25%, 5% of the population. How do you explain that? Over the Bronx, Brooklyn, Queens, Manhattan? That is a devastating reality and consequence of this action. Furthermore, why they would cheer on a person who violates the rules, which has now demonstrably resulted in more people dying, right? Well, maybe if we don't follow the rules, it won't matter. Okay, let's try it, says Staten Island. We don't follow the rules. Okay, now you went from the lowest death rate to the highest death rate in the city. I guess there was a connection there, wouldn't you say? But then why they would cheer on a person who violates the rules, gets in a Jeep, and runs into a uniformed police officer and hospitalizes the police officer. Why would you cheer on that behavior? Why would you not condemn that behavior? NYPD, uniformed law enforcement, you're going to abuse them, assault them? That's not Staten Island values. That's not New York values. Staten Islanders respect law and order. They respect the NYPD. They respect law enforcement. That's who Staten Islanders are. That's who they've always been. They don't cheer people who drive their car into law enforcement officers. That's not who they are. And I don't want to second guess the district attorney, but you have a uniformed law enforcement officer on the hood of your car for 100 yards, and he's hospitalized afterwards. That sounds like an extraordinarily serious situation. And when I was the Attorney General, you assault law enforcement officer, I would throw the book at you. I would throw the book at you. And that's my 2 cents. Okay, thank you all for joining us.